Good evening, everyone. This is Dr. Swati Pandey. So I'm going to talk about hypertension or high blood pressure today. So my first picture, as you can see, I have mentioned normal and abnormal ranges of high blood pressure. Normal is less than systolic 120 and diastolic less than 80 millimeter of mercury, and then anything above than that is called abnormal. But there are stages of that. So there is pre-hypertension stage 1, stage 2, and then there comes hypertensive crisis. So pre-hypertensive stage is 120 to 129, and stage 1 is 130 to 139, and diastole is 80 to 89. High or stage 2 is more than 140 over more than 90. These are some ranges. So more than 120 and 80 is considered normal, but that doesn't mean that only 120 and 80 value is normal. So what I want to say is even 110 over 70 is normal. For some people, even 100 over 60 is normal. It depends on person to person, and it depends on how they tolerate it and how low they can go with their exercise and everything. But more than 120 and 80 is abnormal, but even 110 100 value or diastolic 70 60 can be normal. So it just depends what your value is, and if you have doubt, obviously you can ask a doctor. So in my second picture, I am showing you that howsoever your blood pressure is, if you're having all these symptoms, for example, if your blood pressure is 150 over 90, on one look it doesn't look so bad, but if you come to me with any of these symptoms which are mentioned here, that you're having some visual disturbances, you're having severe chest pain, if you're having back pain, severe one, and if you're having difficulty in breathing, if your lab work shows that you have kidney or KFT deranged, if you're pregnant and if your blood pressure is high, that's called eclampsia, or if you're on some medicines which are causing your high blood pressure, or if you're having symptoms of stroke, which is called lakwa in normal language, or if you have had head injury, or if you're acting strange or agitated. So these are the symptoms of hypertensive emergencies. That just means that when you come to us with such symptoms, we have to do ECG and other investigation like X-ray. Right away we have to check you for heart attack, and we have to treat it right away with medicine. We have to bring down your blood pressure, and we have to rule out that if you're not having a stroke, so we might have to do a CT scan. These are called hypertensive emergency. Do not try to treat these at home. If you're having any of these symptoms, rush to the hospital. So that's what my next slide says, that when to visit physician. So if your home readings of blood pressure, if you have a home blood pressure monitor and you do measure it consistently, and if it is consistently more than 120 over 80, do not think that it is okay as long as it is 130 over 90 and it's fine. Just visit a doctor and see how it is. Second is, if you're having any of the symptoms I mentioned above, just rush to the hospital or a doctor, because do not ignore those symptoms. They can be life-threatening. If you're a young person, for example in your 20s or 30s, and if you're high blood pressure, you might have some condition like vascular hypertension, or which we call secondary hypertension, that you might have a reason that why you are so young and you have high blood pressure, and that can be treatable. So if you have high blood pressure in your young age, you should see a physician. When you turn 40, a lot of things change. Our body starts to age. So when you turn 40, you should go for your annual checkup. And at your annual checkup, your physician will always check your BP. And if it is high, then you will have to go more frequently. So these are some things when you have to visit physician. One question people always ask me that if I go to a doctor, they're just gonna put me on the medicine and I will always be on the medicine lifelong. That is not the case. When you come to us, we measure your BP. We call you again to measure your BP. If your two readings are consistently high, or if your home readings are high, then first step is to determine why you have high blood pressure. Is it genetic? Is it dietary? Is it something you're taking, like some medicine? Or if you have a pathological problem which can be reversed, and for example hyperlipidemia, obesity, which can be reversed, and your blood pressure might be just gone with that. Next step is we will give you a strict diet regimen. It is called DASH diet for hypertension, and exercise regimen, which you will have to follow consistently, at least for a month. It depends how high your BP is. If your BP is in pre-hypertension stage or stage 1, we might just observe you with this lifestyle measures and see how your BP does. If it is controlled without medicine, with this DASH diet and exercise, we will continue that. There is no need to put you on the medicine, or just put you on the medicine for like a week or so and then take you off of it if your blood pressure is controlled with that. But if your blood pressure is very high to begin with, or if you are having hypertensive emergency, or if you have done all of that, if you have followed a diet, you have followed an exercise regimen, and it is not getting better, then unfortunately it is not an option. We have to start you on the medicine, because high blood pressure does cause a lot of damage to your kidneys, to your heart, to your brain. But it doesn't mean that you will have to be on it for lifelong. As I said, that consistently exercising and following a good diet, you might come off of it. I'm not guaranteeing anything, but it differs from person to person. You will work with your doctor, and sometimes you do come off of it if you do everything in the right way. But if you do have any questions, please contact me, and I'm mentioning my contact info in the next slide. Hope it helps. If you have any question, please do not hesitate to ask. Thank you.